Recently over here, the current British Health Secretary, Health Minister, Wes Streeting, boasted about the fact that he was cutting time for, say, you and I to go and see a doctor if you live in the United Kingdom. Let me tell you, that's an absolute farce, number one, but this is a really interesting story. And the thing about that is we have this 8 a.m. what they call rush. So if you want to see a doctor, doesn't matter who you are, what age you are, you have to bring that surgery at 8 a.m. But miraculously, all the appointments have gone by the time you finally get through, if you're lucky enough to speak to somebody human. But have you noticed that they're very keen to get you in there, for instance, for, shingles. Even I got another one the other day about, the, the coronavirus jab. It's time for the update. What update? Nobody's mentioned it. I'm not interested. But you try and get something that you want, whether that be a blood test for work or insurance or something like that. No. Now, this happened to a colleague of mine the other day. And I wanted to point this out because first and as always, I like to know, does this happen to you? And then I found out the true background to this particular story. As ever, let me explain. Morning, chums. Lovely to see you here in the basking sunlight, of course, of London. I hope you're keeping well, whatever you do. Doesn't it look nice? It's just nice, isn't it, just to sit in the sun? But nice to, sorry, we haven't done a wave. Nice to have your company, as ever. I talk about health a lot on the channel because it's important to us all, and particularly as you get further down the line, it's really worrying if you can't get to see the doctor for whatever tablets you need, whether you just want a general checkup, or you might just feel out of sorts. And it's all very well, isn't it, going to the pharmacy, but I don't know about you, some of them are brilliant, some of them are not. They just point you to tablets or whatever else they're selling that particular day. My particular favourite with my particular surgeries, just take some paracetamol, right? It doesn't matter what you've got, you just take paracetamol. A colleague of mine, though, recently had to have just an appointment, a doctor's appointment, to see where he was with a certain medical condition, right? And it'd taken him ages to get this appointment. And, he tried and got, every time couldn't get in, went in to see the surgeon, couldn't get in, nobody would book him. Finally, he gets an appointment and he's absolutely cock-a-hoop, over the moon, can't believe it. He's travelling there. Now, it's not a doctor he's seen, he's just seen a general nurse. This is for a simple blood test, right? So a general nurse. Within 20 minutes of getting near that surgery, he received a text, not a phone call, a text, basically saying they've cancelled the appointment and he needs to rebook. They didn't say when he could rebook or offer him another appointment, they just booted him. And I thought, this is interesting. And he told me about the, what had happened. And naturally, he was upset because, he'd waited a long time. Turns out, you see, that particular doctor, nurse, whatever you want to call it, well, down the road, guess what? There's a very busy migrant hotel. And the reason why these particular surgeries decide that they'll just dump you, the paying customer, as it were, is because they can pick up more money from the government each time they send out a doctor to go to a migrant hotel. You see how this works. So consequently, you can rebook and when they can see you, and this might happen again, but once the minute that they go into that hotel, they can charge. Now, as I've told you before, chums, the only way that I would suggest that you get to see a doctor, if you can, would be to agree to go for, the shingles or the, coronavirus, whatever. When you get there, say you've changed your mind, but now you just like to discuss this. They can't refuse once you're in the room. As a medical practitioner, they have to deal with the worrying thing that's in hand. You can always say, you'll come back another day, you've developed a phobia of needles. Play them at their own game, because clearly they're not looking after you. And despite what the Health Secretary, Wes Streeting, says, an esteemed GP came out and said that's truly not true.
To employ 1,000 more GPs by the end of March. We've actually exceeded that number. We're on just over 1,500.
When we looked at the figures, though, what we find is that those 1,500 GPs recruited to the ARS recruitment scheme, which is additional roles reimbursement scheme, has resulted in a smaller number of GPs than actually portrayed in the media. 1,500 was the headline figure. This equates to 850 full-time equivalents. And actually, when you look at the data, you can actually see that there's actually been a reduction in locum GPs like myself who are getting less work. So actually, the overall impact of this policy has actually seen only 300 more GPs working in general practice. So it's hardly going to end the 8 a.m. rush. Equally, advice and guidance was portrayed as being something that could reduce the number of referrals that GPs make to hospitals. We're getting advice from hospital consultants. I've got to say we've been doing this for 4 or 5 years, and although it is having some impact on referrals, generally speaking, it's reducing the time that we're having to wait for advice from consultants with long waits for hospital treatment. So all it's really doing is improving care for patients in the community while they wait. It's not necessarily reducing the number of referrals. So patients can be reassured. They are going to get referred to be seen by consultants when needed. But actually, neither of these policies are going to end the 8 a.m. rush or improve access to GPs. What we actually need is more funding in general practice. So to bring back the family doctor and end the 8 a.m. rush, Labour needs to improve the funding to general practice.
Once again, a minister caught lying. How can you believe that? Eh? Neil Sean in the very heart of London.